Hello and welcome to the CARES channel. Today we're talking about something many patients with HER2-positive breast cancer wonder about. Perjeta. Do you really need it? Why do some patients receive both Perjeta and Herceptin, while others get just Herceptin? Are they the same thing? What are the side effects? Is it necessary for everyone? Let's take some time together today to unpack all of that in a clear, simple way. Let's start with the basics. What exactly is Perjeta? Perjeta is a targeted therapy that blocks a protein called HER2, which helps cancer cells grow and spread. More specifically, HER2 proteins like to pair up with other proteins, forming dimers that send strong growth signals. Perjeta blocks that pairing process, stopping cancer's ability to signal itself to grow. But what about Herceptin? Aren't they kind of the same? Yes, they're both HER2-targeted therapies, but they work differently. Herceptin binds to the outer part of the HER2 receptor and blocks it from sending growth signals. Perjeta, on the other hand, binds to a different part, the middle, and prevents HER2 from forming those growth-boosting pairs with other proteins. In other words, they target the same protein, but in complementary ways. That's why using them together can be much more powerful than using just one. But that doesn't mean everyone needs both. Perjeta is used in specific situations only. Let's break it down. Before surgery, called neoadjuvant therapy, when the tumor is large or there's lymph node involvement, doctors often use Perjeta plus Herceptin plus chemotherapy to shrink the cancer. After surgery, if there's a high risk of recurrence, Perjeta is added to Herceptin as a maintenance therapy. In metastatic breast cancer, where the cancer has spread, Perjeta and Herceptin are typically used together as first-line treatment. So if your cancer is more aggressive or has spread, the dual approach is usually recommended. Now, how is Perjeta given? It's administered by IV infusion at the hospital. The first dose is 840 milligrams and takes about an hour or more. After that, the maintenance dose is 420 milligrams every 3 weeks and usually takes about 30 to 60 minutes. In most cases, Perjeta and Herceptin are given on the same day, so be prepared to spend a bit of time at the hospital. How long does treatment last? For early-stage breast cancer, the typical course is 1 year of Perjeta and Herceptin. For metastatic cases, the treatment continues as long as it's working and the patient can tolerate it well. Now let's talk about something really important. What side effects can you expect with Perjeta? The most common side effect is diarrhea. It often starts a day or two after the infusion and can range from mild to severe. It's important to stay hydrated, and if it becomes bothersome, medications can help manage it. Another potential side effect is heart function changes. Because both Perjeta and Herceptin can affect the heart, your doctor will likely order a heart ultrasound, known as an LVEF test, every 3 months. Most people feel fine, but if you notice shortness of breath or rapid heartbeat, tell your doctor right away. Other common side effects include fatigue, nausea, headache, and low-grade fever. If you're receiving chemotherapy at the same time, you may also experience hair loss, mouth sores, and a low white blood cell count. And one more important note. Perjeta should not be used during pregnancy. It can harm the unborn baby, so reliable contraception is essential during treatment and for a few months afterward. Be sure to talk with your doctor about your family planning goals. So why don't all patients get Perjeta? There are 2 main reasons. Some patients simply don't need it. If your cancer is early stage and the risk of recurrence is low, Herceptin alone is often enough. There's no need to overtreat when it won't provide significant added benefit. Side effects can be more intense when using both medications. Still, the benefits of Perjeta have been well studied. The Cleopatra trial showed that adding Perjeta to Herceptin and chemotherapy in metastatic HER2-positive breast cancer helped patients live longer and delay disease progression. But again, this benefit was mainly seen in advanced or high-risk patients, not in everyone. So, what's the bottom line? Perjeta and Herceptin together are a powerful combination that can significantly improve outcomes for many HER2-positive breast cancer patients, but they're not necessary for every single case. If you're receiving Herceptin alone, that doesn't mean your care is lacking. It means your doctor made a personalized treatment decision that's just right for your cancer type and risk level.